Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, who is the Deputy Health Officer for the county, as well as Dr. Earl Stoddard, Acting Assistant Chief Administrative Officer. Reporters, all of you should already have permission to record. If you do not, use the chat to ask for it, and later on, utilize the chat as well for the portion of the Q&A of this presentation. And with that, I toss it to you, Mr. County Executive.
So good afternoon, and thank you all for joining us again today. I will be going through a briefing again. I want to start by just talking about, last night we had National Night Out. We had 44 community events in the county, and I attended several of them with the chief of police, the state's attorney, the fire chief, and the sheriff. We had county offices, social service offices represented at many of these events, and I thought it was a great success, and it was really nice to see so many people out last night. It's a tribute to the success we've had in getting people vaccinated, that people felt comfortable to be out. But it's also, we're still dealing with the Delta variant and the problems that it's causing, and you're going to hear a lot more about that later. I traveled from the East County to the Up County neighborhoods, and it was great to see all these people. And I want to thank the community and our departments for organizing this year's National Night Out. It was a beautiful evening, and this is one of those events that we missed last year. In the COVID world, today we find our positivity rate to be 2.42%, and our case rate is up to 7.49 per 100,000. And yesterday we had 98 new cases. And just to remind everybody, it was about a month ago, we were looking at single-digit cases. So this is a significant increase in cases we're dealing with. Thankfully, our hospitalization rates remain low, and we had 3 new hospitalizations yesterday. But if you look at our total hospitalization rates, I think as you'll see later, these numbers are actually also going up, both general hospitalization and ICU use. For the last few weeks, I've expressed my concern about the impact that the Delta variant could have, and unfortunately, it is spreading at an alarming rate. I think it was yesterday, Florida set a record for hospitalizations, and this is a record with more people vaccinated than they did last time they set the record, and which is kind of a pretty dire warning that even with more people vaccinated, they're sending more people into the hospitals. So this variant, we know, is spreading more rapidly. It seems to affect more people. There are articles that are, they're looking at the severity of cases now and the impact on young people or younger people. And these are all things we're going to be paying close attention to. I want to share 2 graphics that show how quickly our data has changed. And the first is this map from a little over a month ago. And as you can see, most of the state is green, which means very, very under 1 case per 100,000. And then the rest of the state is, right around between 1 and 2 cases per 100,000. There are 2 outliers that are, like 2.46 and 2.03. But basically, we're looking at a whole state that was at 1 to 2 cases per 100,000. Now, if you go forward to the next map, what you're going to see is the case rates data through 8/3. And you'll notice there are no green areas left on the map. Montgomery County is up to 7.49, so that's 7.5 times where we were before. Prince George's County is at 11.54. On the Eastern Shore, you see counties as high as 23.71%. So you can see kind of what's happening in the county this way. So it's, very concerning to all of us. And this is, what has us worried and has us being really careful about what it is we're going to do. This week, we continue to see, as I said, increase in our case rates, although we're still within moderate transmission rate, according to the CDC. And we're not alone. 80% of this country, 3,000 counties, or 90% of the nation's population, are in the zone of substantial transmission rate. 90% of the nation's population is experiencing substantial transmission. including nearly all our neighbors that you can see on this map below. Montgomery County is the jurisdiction that has the purple circle around it. I don't know if we can get that graphic on the screen, but that's Montgomery County, and we're surrounded basically by orange and some red and one blue county somewhere out there. But these are, really alarming rates, and these are changing. And frankly, we expect that we will be orange within the next day or so because of the increase in the cases that we've seen. The fact that we have remained in moderate transmission is a testament to the success we had at vaccinating our residents at a much higher rate than the national and state averages. We're still about 99% for seniors and in the 80% for people between 12 and 65. We have a remarkable number of people vaccinated. But even with that, Delta is finding a way to spread, and we do have this large unvaccinated population under 12, and we've got over 100,000 adults who have not been willing to get vaccinated yet. And this is the map I was showing you. Of course, Maryland is that weird one where you can kind of tell the squiggly black line is the Potomac River. Underneath us is Virginia. On top of us is Pennsylvania. Delaware is hanging out on the right. And you can kind of see what's happening all around us. It makes it very clear that we're an island, but we're not going to be an island for very long. Pretty much the denser part of Maryland has gone orange, and we will be one of the next ones to flip, and we expect that trend to continue. And you can see Virginia is almost all orange and red. West Virginia is mostly orange and red. New Jersey and Delaware are orange and red. Pennsylvania, you have the yellow and orange there. But these are the things that are concerning us, because this is actually happening all around us. And as we've tried to remind people, Montgomery County is not an island. So we're seeing an uptick in our testing, and that's a sign that our residents are concerned. That's something we were hoping for. We continue to make testing widely available, and we're once again working to set up more community testing sites so people can come in and get tested. Tomorrow, the Montgomery County Council, sitting in the Board of Health, will vote on our recommendations that face coverings be required in the event that the county's transmission status increases to substantial. And again, we're estimating based on current case levels that we would hit that mark tomorrow or the next day, but certainly in the near future. Similar to the success we had when we created triggers tied to vaccination rates during our reopening in May, we believe that this approach makes it clear to our residents when masking guidance would change. And so hopefully people understand it's based on what we're seeing now in these case rates. And we can continue to support the science that says masking makes a difference. And so this is what we hope is, as far as we have to go. We're not looking to shut things down. I've gotten many strange emails from people saying masking is, going to lead to shutting down the schools. Everything we're doing is to prevent us from shutting down things. It's not leading to shutting down things. It's trying to take steps that'll minimize the spread of the virus so that we don't wind up where we were before. With our highly vaccinated population, these kind of precautions can hopefully make a difference and keep us from falling into a place that we really do not want to be in. I believe this also incentivizes our residents to pay attention to our case rate of transmission and do their part to keep our transmission rate at the moderate or lower level. We're also encouraging our unvaccinated residents. We need them to get vaccinated as soon as possible. If you're unvaccinated and you get COVID, you pose a risk to all those children out there under the age of 12. And we're on the verge, within a month, less than a month now, of reopening our schools. We do not need adults getting infected and bringing it home to their children and having those children go into the schools. This is why people need to think about more than themselves. They need to think about how, our actions play out and affect other people. Similarly, we do have some adults who aren't fully vaccinated, and we know that continuing, this virus is harder on older people than it has been on anybody else. Though again, as I think you'll see later, the number of cases among younger people is ticking up in a way that wasn't true before. We have 71% of our residents have received both doses of Pfizer and Moderna or a single dose of J&J. We continue to lead the nation at 83.7% of our eligible population vaccinated, and 92% of our eligible population, that's people over 12, have at least one dose. 83.7 with both doses and 92% with one dose. That is an amazing accomplishment for everybody who's listening, and it's a great story to tell. We just need to finish the job. It would be so sad if we can't get this job finished and we watch these cases spike again when we know that the vaccine makes a difference in how this virus will spread. So if you're on the fence and you're thinking about it, please get off the fence and please get vaccinated. We want to be sure that our community, that those in the community who aren't eligible to be vaccinated, particularly those under 12, are protected. I know no one wants to go back to wearing masks, but in the absence of, 100% vaccination rate or something higher than where we are now, masking is the best way to protect our health. We have holes in our population, so we know that they're heavily concentrated, the unvaccinated, than those who aren't eligible, which would be the children. And then we've got other groups and age groups that seem to be holding out more than others. When you're at 99% of your seniors over 65 vaccinated, that means pretty much everybody, regardless of political allegiances or race or culture or anything else, they've all made that decision to get vaccinated. We need everybody else to make the same decision. I say this, every week. I'm going to keep saying it until we get where we need to be. But if you haven't been vaccinated, get vaccinated. As President Biden said yesterday, this is a matter of life and death, and it's as simple as that. When we were doing all the work we did to keep people safe over the last year, we were all aware that every decision we made was essentially a life and death decision. Every door we opened to people opened the door to the virus. That's why we were as careful as we were, and that's why we're continuing to be careful now. We want to slam the door on the spread of COVID, and that's our goal. And I'll be totally upfront about it. We need to shut this virus down, and we have the ability to do it. So it's on us to get this job done. Yesterday, the Centers for Disease Control issued a temporary moratorium on evictions that is separate from the CDC's prior eviction moratorium that expired over the weekend. We welcome this action. The new order, which expires October 3rd, covers counties experiencing substantial or high levels of COVID-19 spread. Like I said, we're not there today. We'll most likely be there very shortly. Our state moratorium continues to be in place until August 16th. So this would provide us protection from the 16th to October 3rd if we stay in either the substantial high levels of transmission. And we're waiting for the District Court of Maryland Chief Judge to issue a directive for how Maryland courts will handle this change. However, our key focus remains the same, keeping as many families as we can in their homes. And I'm proud that we've distributed over $30 million in total rental relief. And we're working now directly with landlords to help us make sure we're getting applications from renters who need it most. And additionally, we're prioritizing any renter who is on the eviction list. And I want to thank our sheriff's office for their efforts and outreach and coordinating with us. And in case you're wondering, when we were originally processing applications, we were processing them as they came in. As evictions have begun, the sheriff's office was given this list of who's going to be evicted over the next couple of weeks, and they're now sharing it with us. If we find somebody's name, when we do find somebody's name, we check it against who's applied for rental relief. If they're in the queue, we accelerate it so they can get their relief before the sheriff has to enforce an eviction. And if we find people who are getting ordered to evict but who have not submitted an application, we're reaching out and working with our nonprofit partners and with some of the landlords to make sure those folks get their applications in. The landlords, I have to say, have as much interest in this as everybody else does, because if these folks get the relief that we have it means they're going to be paying the back rents. And I'm sure that's important to landlords. It's important to landlords, obviously, because they've got mortgages to pay, and it's important to tenants because they need a roof over their head. So we have a great symbiotic relationship here. We just need everybody to work together. Finally, before I turn it over to Dr. Bridgers and Dr. Stoddard, I wanted to mention a couple of business-related updates. Last week, I visited American Gene Technologies as they celebrated the Data and Safety Monitoring Board unanimous vote to continue their HIV cure program without modification. After a safety analysis of the participants' data revealed no adverse effects from the treatment. This is a potentially really significant drug treatment if it gets through the FDA approval process. And just want to thank them for the work they're doing. AIDS continues to bedevil the population. And while it doesn't have the death sentence that was attached to it when I was younger, it certainly still requires a lifetime of treatment. And this may be a way out of that. And so this is an important medical advance. There are 37.9 million people worldwide, including 1.2 million people in the United States who are living with AIDS. And AGT is one of the many bio and life sciences company whose work and efforts are creating, products that are going to make a difference for all of us, and products that can save lives and improve health outcomes of individuals all around this globe. I also continued my small business summer tour last Friday by visiting 3 businesses in the Albany area, a civil engineering company, O'Connell and Lawrence, the Backyard Naturalist, and the Brookfield Brewery, which I am happy to point out when we were doing the minimum wage when I was on the council and we were out there for their opening, the owner of the brewery talked about how important it was to pay people the $15 minimum wage. And it's great to have a business leader who understands the importance of paying people a wage they can begin to have a chance to live on. This week, I'm going to be visiting the Parkway Deli and Bankers Business Management Services. The Parkway Deli was where my daughter gummed her first bagel to death. It was like her first solid food. And I still remember the soggy mess that it made as she was gnawing her way through it. So it has I have a special affection for the Parkway. I'm going to continue to do these visits on Fridays. And I really enjoy meeting the small business and learning about the difficulties and challenges of the last year and seeing what we can do for them to help them succeed moving forward. And I encourage everyone to shop small, shop local, shop often. If we wind up with mask mandates, you can still go shopping. We're not trying to close things down. So if we tell you in the next couple of days that we're going to be using masks, just wear the mask and continue to, go about as much of our normal lives as we can. So again, thank you for your time today, and I look forward to your questions.
Thank you, Mr. County Executive, Dr. Bridgers. And by the way, we do have a 1:30 hard stop today.
Good afternoon, everyone. Happy to provide the Public Health Services update, COVID-19 update on behalf of Dr. Gales. I'm going to share my screen and just as we typically do, provide a quick update. So the county executive talked about our case rates. We have 98 cases today, 3 hospitalizations, no death. Test positivity is 2.42. And again, our case rate is 7.49. We continue to vaccinate our countyans. We continue to look at those spaces within the county and work with our community partners to have encourage folks and reduce vaccine hesitancy or any vaccine apathy. Currently, CDC estimates that we've vaccinated 71.1% of our countyans, which is indicative of the hospitalizations and the few hospitalizations that speaks to the efficacy of the vaccines that we have. The question has come up regarding our testing spaces. The county executive was very fortuitous in asking his agency leads to have contingency operations in place based on the modeling that we follow at CDC and at the state level. We currently sit at a moderate transmission rate, but we are quickly moving, if we haven't moved, into the substantial transmission rates, which requires us to put more preventative measures in. A month ago, Mr. Elrich showed and demonstrated the slides where we were as far as our case rate. And we've moved to 7.49, where we are in a yellow and amber state, but we suspect that we will be moving to an orange state. And we have the test apparatus in place. We're testing 7 days a week, 9 through 6, at our Up-County Regional Health Center, our Dennis Avenue Health Center, and our Montgomery County Rockville campus at their Southern institution building. We have the means and the capability to scale up and scale down, and we've done such regarding not only testing, but also our contact tracing. As the cases have increased, we've increased our contact to those folks who test positive. And so we have the flexibility and the measures in place to not only test and vaccinate. I will stop there, subject to any questions, and turn it back over to you, Lorna, for Dr. Stoddart's comments.
Thank you, Dr. Bridgers. Dr. Stoddart.
Good afternoon. I just have a few comments. See the questions here with about 20 minutes left. I just wanted to note that we have been in constant conversations, both at the public health level, but also from the county executive's office with Montgomery County Public Schools, monitoring what's been happening in their summer education programs. As I think I noted last week, I actually have a middle schooler and an elementary schooler who went through the summer in-person education programming, and it went mostly very well. But one observation that MCPS did make is that as our cases in the county have increased from week to week, so too have their instances where they have had some issues with a student introduction into their, or student or staff introduction into their environments. And obviously they have been tracking that very closely with an eye for what's going to happen as we come up over the next month and return to school for the fall, understanding exactly what the implications of increased case rate will be for them. And one thing that they did share is that, many of the cases are they're able to, prevent any further exposures and reduce the quarantines, but there are some cases that end up in resulting in a large number of potential contacts that have to then quarantine or be tested. And so in some instances, it's 0 contacts. In at least one instance, there had 24 contacts that were identified of particular individual who tested positive. So obviously that has implications for the fall as our case rate goes up. We talk about, students not getting as sick, but obviously any interruption in their in-school educational experience is, something we're trying to avoid this fall at all costs. And so obviously part of the recommendation to the Board of Health around the indoor mask mandate, if we were to reach substantial transmission, as we expect to do, is to really try and protect and preserve the integrity and the quality of the in-person education that MCPS and our private schools are going to be offering here over the next coming months. So I will stop there, and we certainly can take questions.
Thank you, Dr. Stoddart. First set of questions coming from Kate Ryan, WTOP, and their director to the county executive, and Dr. Bridgers. Kate, good afternoon.
Thank you. Good afternoon. I appreciate it. I did have a quick question on substantial. A colleague of mine did the math looking at your data points and came up with, it looks like we are in fact in the substantial range at 52.5. When and how will you declare when the county is in the substantial range? And the question comes up, if a mask mandate is declared or called for, if the numbers drop below substantial, would that mean, okay, now no mask mandate? How do you keep from confusing things? What would happen? That's number one.
So I'll start off, and Kate, thank you for that. Currently, when I looked at our team, and we had this conversation this morning, Dr. Stoddart, Dr. Gales, and I, and provided the county executive with an update regarding our projections and statistical modeling. Currently, CDC has us at 47.59, I believe. And in some models, I know Dr. Stoddard and I talked about, we are over that. When we actually see that and receive the data out from CDC or the state that we are in a substantial transmission mode, that would be the indicator that we are actually there based on all predictors that we have been using over the past 16 months. Now, your question regarding, if in fact we are at substantial transmission, the trigger to return to a policy where masks would not be reinstated would be a consecutive 14-day transmission, where we see those at a moderate or low level. So those are the indicators that we are monitoring as we continue to move forward. And as we've done before, we have those safeguards and preventative measures in place. We also are monitoring the hospitalizations, deaths, test positivity rate. So those are the triggers and indicators that we're looking at. The CDC has a statistical modeling of 7 days. We're looking at the states 14 and 7 to identify those triggers that would be indicative of where we need to move in Montgomery County.
Kate, I would only add that we are in conversation with members of the County Council acting as the Board of Health around adding a specific rollback provision. That is something that they have suggested that they might be interested in doing tomorrow. I don't know where it's exactly going to fall out, but I do think that one possible model is what the CDC just provided for the eviction moratorium, which is that if you are below the threshold for 14 consecutive days, then that would trigger a rollback from the eviction moratorium. So that's something that CDC has provided as guidance that they think is appropriate for when you drop below substantial. And so that is something that we are looking at as potential. And obviously we'll be up to the Board of Health. It's their determination. We're making recommendations around that, but that was something that we felt was fairly reasonable in terms of an expectation. We're obviously concerned about the yo-yoing, right? You could go below, above over a period of time. And so I think we're trying to add some more integrity to the process, where it's not going to be a day below and then a day back above and then a day below. And so I think that's the guidance that we're likely to provide to the Board of Health, and then they'll choose to act on it how they will. And so I would expect that the draft provision that the Board of Health posted, that the council posted, will be modified by the time it's acted on tomorrow. And so I think that you're likely to see a provision that explains exactly how we would roll the provision back.
Terrific.
That's really hoping to do. I want to be very clear about that.
Got it. And very quickly, I'm mindful of the time constraint. On evictions, again, can you explain precisely what has to happen? The county can't just say, okay, we want a moratorium to protect people. Is it dependent on the state, the governor taking action? What has to happen?
Well, I mean, at this point, we have these federal guidelines that'll last to October 3rd. The governor could have done it because he did it before. He's made a decision that it's going to expire and he's not going to extend it. At least so far, he's not going to extend it. So we're at the point where, we will use the CDC moratorium to keep this going. And that certainly helps us get more stuff out to folks before they actually face eviction. We really feel like we're running in this race between trying to get money out the door and trying to make sure that no one slips through the crack and gets evicted because we didn't know about them. So we're really doubling down on working on that. And of course, we've got, if we slip underneath the criteria, which is the next stage for us, where we're thinking about where we're going to wind up going. If we wind up, at a lower rate of transmission, moderate where we are now, then the moratorium would no longer apply. And I have the same question with the feds about the whipsawing of how that will affect, but I think it's based on a 14-day average. So hopefully we will not see this thing change on a daily basis. That would not be good.
Appreciate that. Thank you very much.
Thank you, Kate. Next question comes from Jordan Lindsay, my MCM, and it is for you, Dr. Bridgers.
Good afternoon, and thank you so much. I just wanted to know if there's an update on the number of local COVID-19 breakthrough infection cases, that's vaccinated residents who caught the virus. I just wanted information or data on the current percentage of breakthrough cases in Montgomery County compared to those who are unvaccinated.
Good afternoon, Jordan. Great question. Again, we had the same conversation this morning, and per our discussion, we're seeing about 20 to 25% of the total cases are breakthrough cases, which is about 0.05% of the population. And the other point of that is regarding the number of cases that we have monitored, and we see indexing that 21 to 40-year-olds fall within that category for breakthroughs that need to get vaccinated.
Got it. Thank you.
You're quite welcome.
Thank you, Jordan. Next question for you as well, Dr. Bridges, from Caitlin Keats from Bethesda Beat.
Hello, thank you for your time. Dr. Bridges, I have two questions actually, but the first one, I just wanted to build off of something you talked about earlier. You talked a little bit about the ability to ramp up the county's testing operations. I'm curious, at what point do you do that? Do you wait until conditions worsen, or is that a preventative measure you implement sooner? Can you just explain the thought process on that, please?
Sure, Caitlin, great question. We don't wait. We continue to monitor the data, and as we continue to see the increases in either testing or vaccinations, we apprise Mr. Elrich and our county executive leadership immediately. So over the past 16 months, we've seen a rise and a decrease in not only the testing volumes, but also the vaccination volume. So we use our modeling to mitigate the transmission of that. So we have contingency operations in place, either to scale up static or flexible locations, those point of distribution pods that Dr. Starter referenced with MCPS. Early on in the vaccination process, we had testing pods at various schools. And so we're able to be flexible and to identify those needs either from community engagement. Our community partners are instrumental in informing us regarding the needs for testing. And so we have those in place. Mr. Elrich was, again, very forward-thinking in getting the number of test kits that we had in place. Remember, when we started, we only had 34, and now we have enough to not only test, but to provide those mobile testing capabilities that the county has seen a need in those parts where we have seen less testing or fewer vaccinations. And so it's an ongoing plan that we evaluate and that we revise.
Thank you. Okay, and one more question, if that's all right.
Sure.
Okay. We have in the past talked a lot about children being less likely to get seriously ill from COVID-19. But recently, like within the last week or so, there have been some places across the country reporting more severe illnesses among children. So I really just wanted to check in on how things are going here. Have you seen any of that locally? What are pediatric cases looking like in Montgomery County?
And so based on, again, another great question. And so we've seen respiratory syncytial viruses, colds in our younger population is what our syndromic and our essence data is telling us from the hospitals. We haven't seen an increase. We continue to encourage those individuals, those parents, those caregivers who have children under age 12 who aren't vaccinated to provide and encourage and ensure that our undervaccinated children have mask and face covering when they go into those spaces that are unfamiliar, to have a plan to continue to look at those preventative measures that we spelled out either in recommendations to the council sitting as the Board of Health or in Dr. Gale's recommendations for face coverings. And so we haven't seen a lot of pediatric cases to date that I'm aware of during this time of this press conference.
I think Dr. Gale shared a chart that earlier Dr. Bridges was pulling up while you were talking.
Sure.
And he said, I think over the last month, I think of those hospitalized, I think 4.1% of the COVID hospitalizations have been in those under the age of 9. Another 2% have been 10 to 19. Obviously, with hospitalizations still, even though their case numbers are much lower, the hospitalization rates tend to be those in the older age category still. I don't know that we've seen a huge change because obviously the numbers are very small. So, if, like for example, last week, 0 to 9 was 15% of our hospitalizations. That's because there was 2 of them last week, as opposed to 0 the week before. So it's very small numbers, and you see these jumps in percentages. And I don't think you can make much of a argument over the statistical significance of them. But Caitlin, to your point, if you look across the country, certainly in the South, and you compare it to states in the North, which are much more vaccinated, the rate of infection and the rate of hospitalization among youth really do parallel very closely to what you see in the adult populations, meaning children are getting more heavily infected and more heavily hospitalized in the South, where the general rates of infection are much higher. And I think we're not expecting ourselves to get to that level that we're seeing in the South because our vaccination rates are so high. But it also gives you some sense of why we're not wanting to let our case rate run rampant with no intervention at all, because we know that there are still a pocket of people, mostly including our children, who are unvaccinated, and we, with the Delta variant, we're not inclined to take that risk.
Thank you, Caitlin. The next question is for the county executive and coming from Kevin Lewis, ABC 7. Kevin.
Hi there, good Wednesday afternoon. Executive Elrich, if you had it your way, how would you like to see everything at the Board of Health hearing tomorrow afternoon play out?
They'll support the recommendations we put forward, and we'll be able to move on from there, because, the council is out of session, and we're trying to, come up with triggers that will allow us to act quickly rather than, submit things a week in advance and then wait for, approval. Our experience with the virus is that things can change pretty quickly. I think that was the point of some of the slides we showed. That is, you can think you're fine one day, and then a few days later you realize this is not fine. And you don't want to wait until this thing goes over the edge and then try to pull it back. That's really hard. So hopefully the council will support this action and we'll be able to move forward.
A year ago, after the first few months of COVID, there was a lot of disagreement, I guess, within the community. Some people were, really wanting to reopen the county, so to speak. In light of everything that's happening now, are you hearing from those people who are frustrated, or is that sentiment far less than what we had a year ago?
I do hear from people who would like us, to not close anything down, and I get very strange arguments that I really don't agree with. But most people, I'm more likely to have somebody tell me that you did the right thing, stay strict, don't open, than I am to have somebody tell me, we want you to open and we want you to open tomorrow. I mean, I walk around out there in the community a lot, and what I'm getting from people is, a lot of recognition that, that the numbers in Montgomery County are different because of the things we did in Montgomery County, and they're not interested in being like Florida and Texas, for the most part.
Final question. Do you have full confidence that Montgomery County Public Schools will be in person 5 days a week this coming year for anyone who wants that?
That is the plan they've made. I'm glad you asked that question, because I keep getting these emails, and it's like, well, you're going to mask people and you're shutting down schools. It's like everything we're doing is an effort to avoid having to do something more severe, like shutting down schools. So all of our actions are based on what can we do to make sure we have control over this, so that we can proceed back to school and do the other things that people are counting on. The school system's already told people that this is what they intend to do. So I continue to be baffled by the people who think there's some sinister plot in all this to close schools. There is not.
Great. Thank you so much.
Thank you. Thank you, Kevin. We do not have any more questions from members of the media on the chat.
I think Lorna asked, or Kate asked for a follow-up.
Do you have okay, go ahead.
Yeah, and very quickly, to the county executive, any plans to call for all county employees to get vaccinated, to require that at this point?
You're gonna have to be vaccinated or tested. That's the direction we're moving in.
Well,
And so
when,
people
like
will
that-
have, well, it takes time. I mean, if I told everybody that everybody's not vaccinated or tested, if that started tomorrow, it would still take up to 5 weeks for everybody to get vaccinated, because there's this period of time between one and the other. So, we've got to put the pieces in place, like have vaccinations available. We've got to have the testing put in place so the employees can get tested. That won't take us very long to get that done. Once we have it done, there will be a window by which people will have to comply or just continue to be tested.
so should the message to employees be expect this to happen? It's going to happen?
Pretty much. I mean, if I'm not mistaken, Dr. Starter, that's
Yeah,
where we left it.
We've got a loose agreement with the union representatives that around a framework to allow us to do this. There are some details. For example, we have to work out the confidential medical process for someone to validate that they've been vaccinated. We have to make sure that that system is in place, and we're hoping to have that done over the next week to 10 days. So as the county executive said, that's the intention that he's asked us to move forward with, and there seems to be good strong agreement that that's what's going to happen.
You're good with that response, Kate?
Yes.
Okay.
Yeah, thank you very much. I appreciate that.
Thank you very much, everybody, for joining us today. We need to say goodbye at this point. The county executive's got to go to another meeting, and we will see you again, hopefully next week. Stay safe.
Thank you all.